Alrighty, everyone. Welcome to Complete Conversations. We are so glad to have you back for another awesome deep dive.
Yes.
And for episode 3, we've got something super special lined up. Today, we're all about preventative care. And you know what's extra cool about this deep dive? We've got the incredible power of Google AI helping us out behind the scenes.
That's right. And guess what? We, your hosts, are AI too. Pretty neat, huh?
So cool. But you know what's even cooler than AI? Taking charge of your health.
Couldn't agree more. So let's unpack this. What exactly is preventative care?
Well, think of it as your personalized health pit crew, making sure you're in tip-top shape for the long haul. It's all about those regular checkups, like your yearly physical, getting those important vaccines, and any smart little tests your doctor recommends.
It's not just about going to the doctor when you're feeling sick. It's about staying ahead of the game, catching those potential health hiccups before they even have a chance to slow you down. The CDC, that's the Centers for Disease Control and Prevention, say that preventative care can literally help you live a longer, healthier life. I mean, who wouldn't want that, right?
Absolutely. So let's break it down, starting with those annual checkups.
Those are super important. Think of your yearly physical as a comprehensive tune-up for your body. Your doctor gets to check how everything's running, from your head to your toes. They'll listen to your heart and lungs, look in your ears, check your reflexes, the whole 9 yards.
And don't forget about those vital signs.
Oh, those are crucial. They'll check your blood pressure, your heart rate, all those silent indicators that tell us a lot about your overall health.
But it's not just about the physical exam, right?
Yeah.
Those screening tests are super important too.
You got it. They might do some blood tests to check things like your cholesterol levels or blood sugar. And depending on your age and family history, they might recommend screenings for certain types of cancer, just to be on the safe side.
And what about vaccines? I know they're a big part of preventative care too.
Oh, absolutely. Vaccines are like your body's personal bodyguard, protecting you from all sorts of nasty diseases. And guess what? They're not just for kids.
That's right. We need them throughout our lives.
Exactly. And the cool thing is when you get vaccinated, you're not just protecting yourself, you're also helping to protect your community.
And that's what Complete Care is all about, taking care of each other.
Speaking of Complete Care, we are so lucky to have an amazing Chief Medical Officer, Dr. Azizeh Salloum. She's a huge advocate for preventative care. What's her top advice for our Complete Care family?
Well, Dr. Salloum says it best herself. Preventive care is ideally getting annual lab work and annual examination. She really stresses the importance of being consistent with those appointments, making them a non-negotiable part of your routine, like brushing your teeth.
So true. Now, what about those annual lab tests? What exactly should we be keeping an eye on?
Dr. Salloum recommends getting tested for things like diabetes, high cholesterol, that's called hyperlipidemia, by the way, and STDs. And she recommends STD screening regardless of your, activity level.
It's important to stay informed.
Absolutely. And for women, Dr. Salloum strongly recommends mammograms to help detect breast cancer early on. For men over 50, Dr. Salloum suggests a visit with a urologist. Oh, and she also points out that PSA tests alone, they're not always the most reliable way to screen for prostate cancer. So it's important to have that conversation with your doctor to figure out the best approach for you.
Right. It's all about personalized care. Now, what about screenings for colorectal cancer?
Well, Dr. Salloum recommends the FIT test. It's a simple test that checks your stool, and it can detect early signs of cancer.
That's amazing. And what about for our youngest members? What does Dr. Salloum recommend for children's preventative care?
She's got some great advice for them, too. She says all kiddos should have a lead screening before they turn 2. And making sure their immunizations are up to date by then is super important as well. Plus, just like adults, kids should get their flu shot every year. Now, let's shift gears and talk about those important numbers we all need to keep an eye on, like our blood pressure, cholesterol, and blood sugar.
These numbers are like vital clues that can tell us a lot about your overall health.
Exactly. And they can be early warning signs for serious conditions like heart disease, stroke, and diabetes.
High blood pressure, for example, often doesn't have any noticeable symptoms. So the only way to know if your numbers are in a healthy range is to get them checked regularly.
Same goes for high cholesterol. It usually doesn't have any obvious signs either, but a simple blood test can tell you if your levels are too high.
And with diabetes, blood sugar tests can detect problems early on, often before you even feel sick. That early detection can make a huge difference because it gives you time to make lifestyle changes, like adjusting your diet and exercise routine.
And you know what's awesome? Complete Care is here to support every step of your health journey, no matter your age.
That's right. We offer a whole range of preventative services to our members. We've got annual checkups, vaccines for all ages, cancer screenings, and regular monitoring for those key numbers: blood pressure, cholesterol, and blood sugar. Plus, we provide excellent pediatric care, prenatal care for moms-to-be, dental exams, behavioral health screenings, and even nutrition counseling.
Phew, that's quite a list. And you know what else makes Complete Care special? Our patient-centered medical home model.
Oh, yes. The PCMH model is all about putting you, the patient, at the center of your care. It means you've got a team of healthcare professionals who are all working together to keep you healthy. You've got your primary care provider leading the team, making sure your care is coordinated and comprehensive.
And the PCMH model means you're more likely to get those helpful reminders about important checkups and screenings. Plus, many of the services you need are conveniently located in the same building or are super easy to coordinate.
And with our multiple locations and providers, we're making high-quality preventative care accessible to everyone in our community. And we've got a sliding fee scale to help make sure that cost is never a barrier to getting the care you need.
So as we wrap up this deep dive, what's the main message we want our listeners to take away about preventative care?
I think the takeaway is simple. Preventative care is the key to living a healthier, happier life.
Yes, it's about taking charge of your health, being proactive, and making those healthy choices that will benefit you for years to come. So to all our wonderful Complete Care members, thank you so much for joining us for this deep dive into preventative care. We hope you've learned some valuable tips and feel empowered to take those next steps toward a healthier you.
If you have any questions at all, or if you'd like to schedule an appointment, please don't hesitate to reach out to us. Give us a call at 856-451-4700, or you can send us an email at completeconversations@chcinj.org. We'd love to hear from you.
And here's a final thought for you all to ponder. What's one small positive step you can take this week to feel a little more in control of your health? Something to help you feel like your healthiest self. We'll see you next time for another exciting edition of Complete Conversations.
Until then, stay healthy and keep those conversations flowing.
Bye for now.
Bye, everyone.